People that have diabetes is somewhere around 10%. In Wyoming, it is a little bit less than that, but it's only about 10% of people that have diabetes have ever been referred for diabetes care and education. Diabetes care and education specialists can help throughout the lifespan of a person with diabetes. We really talk about diabetes education and getting the specialized care in a fourfold way.
Well, we call them the 4 critical times simply because they are critical. They are the 4 critical times to go in and see a diabetes care and education specialist. The first time obviously is at diagnosis, because it gives us our best chance to get control of things really up front, to develop those healthy lifestyle behaviors that are going to set the tone for our diabetes management for the rest of our life. And so when you can get a good education up front, develop good behaviors up front, you're going to give yourself your best chance for preventing the chronic complications of diabetes that occur over time.
And then a second critical time is that annual visit that maybe you learn some new information. It's not just about the medications, it's not just about the lifestyle, it's not just about the food, it's about all of it. It's about all of the mingling of providers and the community resources to help those people with diabetes learn how to manage their diabetes better.
I like to tell my patients, every meter tells a story. And so bring your meter into your visit with you. We'll take a look at it together and see what's your story. What's going on with your blood sugars? Why is that going on? And what are maybe some of the small and simple things we can do to address it?
But we don't always need that blood pressure. We don't always need those things that come with a hospital or a clinic visit. Sometimes we just need the connection with the person.
For patients that are very, very remote, that can't drive into an appointment on a regular basis, doing a telehealth visit is a wonderful option for them. 3, when a complicating factor occurs. So if you have diabetes and you've had diabetes for a year and then all of a sudden, a new thing gets added to the list. We talk about medications. Are we on the right medications? Are we on the right dosages? Are we administering those things correctly? Are we checking our blood sugars? What are our blood sugars actually saying? We talk about how do you deal with the depression, the anxiety, the stress that comes from having to manage a chronic disease on a regular basis. That's a complicating factor, something that has the potential to throw things out of whack and get a hold of it before it really does become a problem.
A fourth time for meeting with a diabetes care and education specialist is really a new chapter in your life. Maybe you're moving to another place. Maybe you have a new insurance that now allows for more touch points. Maybe you've had a physical injury that is requiring a little more specialized care. Maybe you're just growing older and you just kind of need a little bit of change in your diabetes trajectory or maybe part of your care. And so whenever there's some sort of change in your medical status, that can be a great time to meet with an educator.
I definitely think that there is a need for getting individuals educated, getting them to be able to understand that this isn't the end-all be-all, that they can definitely make the change necessary. You can be amazing in what you do. Definitely, we're there to support you. And we're not successful unless you're successful. We just want to see you live longer, enjoy your kids and your grandkids longer. So take that leap of faith. We will always be a source and a resource, keep you going, keep you motivated, keep you strong, and our doors are always open.